Hi, we are Group 116. Our group includes Alice Tang, Guan Wang, Fanyi Liu, and Yating Chen. Now I will introduce the background. The Parkinson's disease is a common neurodegenerative disorder that usually affects older people but can also affect younger people. It affects more than 10 million people worldwide, and this number is expected to continue to increase as the global population ages. Parkinson's can affect a patient's ability to speak, make their voice soft and shaky. Parkinson's, there are a variety of medications and treatments that can help manage symptoms. Early diagnosis and treatment is crucial as it can help slow down the progression of the disease and improve the quality of life for patients. Currently, the diagnosis of Parkinson relies on clinic symptoms and physical examination, but is not very useful. In recent years, researchers have begun to investigate the use of the feature to diagnose Parkinson's. The voice usually affects in the form and the reduced volume, change in pitch, and slower speed of sounds. And about the case introduction, we were presented with a dataset containing 40 subjects, 20 of whom were Parkinson's patients and 20 healthy individuals. Each subject was asked to record 26 different sound samples, including 3 substantive vowels, A, O, U, 10 numbers 1 to 10, 9 different words, and 4 rhyming phrases. 26 acoustic features were extracted for these samples, including jitter, flicker, and any others. Our goal was to identify a set of significant variables that can be used to distinguish Parkinson's patients from healthy individuals.
Regarding to research method, first, we categorize the data into PD and non-PD groups. We then grouped each of them according to subject identifier and calculated the mean, median, and standard deviation for each feature. Next, we performed a t-test to determine which features, means, medians, and standard deviations were significantly different between the PD and non-PD groups. In terms of research result, for the mean values, we found significant differences in the following features: number of sound breaks, degree of sound breaks, UPDRS score, PD matrix. For the median, we found differences in the following characteristics: absolute jitter, RAP jitter, PPQ5 jitter, DDP jitter, standard deviation of pitch, degree of sound breakup, UPDRS score, PD matrix. For standard deviation, we found differences for the following features: APQ3 scintillation, EDA flicker, degree of voice breaks. These features may be important for distinguishing PD patients from healthy individuals.
In this part, I'm gonna show our Python code. First, we have to import our libraries. 1 data wrangling libraries, 1 data statistics libraries, and 2 graph libraries. And we have to import our original data and rename the columns. This makes it easier for our next job. And our purpose is to predict the people who have suffered from Parkinson or not. So we have to do some data wrangling for our data set. We grouped the data by subject identifier and calculate each feature's mean, median, and standard deviation. which means we have created 3 types of features for our dataset. And these 2 parts, we're gonna do some data extraction and rename the columns. After the data wrangling, we use hypothesis test to prove that there are differences between 2 groups. The most common function is t-test. We use t-test to calculate the p-value, and then create a p-value data frame. If the p-value is less than 5%, which means there are less than 5% chance to observe the significant difference between 2 columns. And we filter the features, so this is our result. These features and these features and these 3. Eventually, we draw a histogram to show our significant features. And this is our histogram. So this is all of our code.
Next, I'm going to conclude this presentation. We identified a set of acoustic features that differ significantly between PD patients and healthy individuals. These features may be important for distinguishing PD patients from healthy individuals. We propose to use these features for the development of an automated PD decision system, which could recognize PD at an early stage and thus provide timely treatment. However, our research still has many limitations. Firstly, our sample size was too small, including only 40 subjects. Future studies should validate our findings on a large sample size. Secondly, our dataset only included voice samples and did not include other information that may be useful for PD diagnosis, such as the patient's motor ability and cognitive ability. Future studies should consider this additional information. In addition, we suggest that future studies could consider using machine learning methods such as support vector machines, random forests, and neural networks to construct more accurate PD detection models.